And so now you might be asking me, Jordan, I've heard of diabetes before, but I've also heard of something called prediabetes. What is that? And essentially, prediabetes is just the precursor to diabetes, and it means you are on track to have full-blown diabetes if you don't change something. For an A1C, it's usually about 5.7 to 6.4%. For the fasting glucose, it's the range of 100 to 125. And for the oral glucose tolerance test, it's 140 to 199. However, it still means that your sugar processing mechanisms aren't functioning properly. So I usually diagnose this as a kind of a come to Jesus moment to let patients know that if you don't change something, we're heading down the wrong path. In my clinical practice, I pretty much treat prediabetes as diabetes, as I don't think there's really much difference between the two. In fact, the delineation of diabetes itself comes from studies and research, and it makes zero clinical difference to me if you have an A1C of 6.4 or 6.5. Regardless of those numbers, what it's telling me is that your body's not processing glucose appropriately, and we need to do something to fix that. So I want to attack prediabetes aggressively to prevent future problems.